Hello students, let's continue with Mycobacterium tuberculosis. Objectives: pathogenesis, symptoms, laboratory diagnosis, epidemiology, prophylaxis, treatment. First, pathogenicity. Now, Mycobacterium tuberculosis, it is highly successful human pathogen representing the leading bacterial cause of death worldwide. You all know that. Now, its initial or primary infection with M. tuberculosis involves replication of the organism at the initial pulmonary site of infection. Okay, spread to the local lymph nodes within the lung and eventually dissemination of infection to remote sites in the body, means overall. Understood? Now, coding factors or glycolipid derivative of mycolic acid present on the outer surface of Mycobacterium tuberculosis. Sorry, there is spelling mistake over here. Inhibition of migration of polymorphonuclear leukocytes and elicits granuloma formation. Second, immunogenic and can induce protective immunity in animals. I am talking the role about these factors, okay? Third, cases bacilli to grow in culture in serpentine cords. Okay? Symptoms: coughing that lasts 3 or more weeks, coughing up blood, chest pain or pain with breathing or coughing, unintentional weight loss, fatigue, fever, night sweats, chills, and loss of appetite. Okay. Now in pathogenesis, three different things we are going to see: primary infection, active tuberculosis, and military tuberculosis. Okay. Now let's understand what is first primary infection. Now primary infection, it may occur in any organ such as lung, tonsils, intestine or skin. But in children, the usual site is in the lungs and is known as the primary complex. Okay. Now in most cases, the primary complex is asymptomatic and undergoes spontaneous healing by resolution, fibrosis, or classification, resulting in hypersensitivity to tuberculoprotein and some degree of specific acquired resistance. Okay. Second, active tuberculosis. Active tuberculosis may develop as a progression of primary infection or by reactivation of a quiescent primary infection. Okay. Now progression in the sense what? When the M. tuberculosis is not controlled at the site of primary infection, the phagocytosed bacilli will diffuse through the lymphatic vessels and blood streams. Understood? Reactivation means what? Reactivation may occur even after 20 years or more of primary infection following lowering of body resistance and most commonly found in Western countries. Got it? Third, military tuberculosis or disseminated tuberculosis. Now, the primary infection may disseminate by lymphatics or bloodstream, leading to numerous small military tuberculosis in different organs. The tubercles contain numerous bacilli but no caseous necrosis. Fine? Understood? Let's go ahead. Laboratory diagnosis. Now samples, they are collected depending upon the site of lesion. Pulmonary tuberculosis, sputum. Meningitis, CSF, cerebrospinal fluid. Bone and joints, aspirated fluid. Renal, 3 samples of urine, means 3 consecutive morning samples are taken. Okay. Microscopy, Zell-Nelson staining, acid bacilli appear as pink brightened rods. Okay, only this staining is done. Fine. direct nucleic acid probe culture. Now what it is? Now in this I'll let you know a thing. Just a minute. Now I'll provide you with the notes for this. Then identification, and last is skin test, for which Mantox test is done. Fine. Next, prophylaxis. Stopping the transmission of TB from one adult to another. This is the first prevention. Next, there are several other prevention activities. This includes preventing people with latent TB from developing active and infectious TB disease. Then next is control, including the use of masks and respirators, which means preventing the transmission of TB in such settings as hospitals and prisons. Pasteurization of milk, it can prevent. Then next is a small contribution to TB prevention will be the vaccine of TB. It does little to interrupt the transmission. Among adults, TB precautions is must. Okay. Cough etiquettes. So in open areas, in public, people should not cough directly. They should close their mouth and nose with tissue. Okay. Next, treatment. TB drug treatment for the prevention of TB, also known as chemoprophylaxis, can reduce the risk of a first episode of active TB occurring in people with latent TB. Isoniazid is one of the drugs used to prevent latent TB from progressing to active TB. Okay. Isoniazid is a cheap drug, but in a similar way to the use of the BCG vaccine. Understood? Children rarely have infection, and it is hard to administer isoniazid on a large scale to adults who do not have any symptoms. So, taking isoniazid daily for 6 months is difficult in respect of adherence, and as a result, many individuals who could benefit from the treatment stop taking the drug before the end of the 6-month period. Fine. One more thing. The benefit of isoniazid preventive therapy for people living with HIV and who have or may have had latent TB has also recently been emphasized. Fine. This is the treatment part. Okay. If you have any doubts regarding Mycobacterium tuberculosis, do ask me. I'll provide the notes. Don't worry. Okay. Thank you.